Hey everybody, I'm Dr. Daniel Amen, and I am here tonight to answer your questions. And so we asked a number of days ago for people to submit questions, and I thought I would go through some of them just to see what's on your mind and to tell you some of my thoughts on it. And I have a whole bunch. So let's get started. And the first question, is there a vitamin that helps concentration and to be sharper in thinking? And somebody asks, is it too late? If you submit them, I'm going to do this on a regular basis. So if I don't get to it tonight, then I'll try to get to it as I can. And I'm going to try and answer questions of a more general nature. That way, everybody potentially could be interested in it. Because ultimately, what watches, somewhere between 10 and 30,000 people will watch this. And so, good evening, Canada, and North Carolina, and New Jersey. I always love it when you tell me where you're from. So, is there a vitamin to help with concentration and help the mind be sharper? And I think everybody should take a multiple vitamin. We actually make one called Neurovite Plus. It's way more than a multiple vitamin. I mean, if you actually look at it, the RDA of some of the B vitamins are like 1,000 times, because what we want are dosages that actually really support brain health. And that's why I just love Neurovite Plus. That 2,000 units of vitamin D. And I talked recently about how important vitamin D is for mood and memory and immunity. And there was a study recently from Indonesia showing that low vitamin D levels was actually associated with death from COVID-19. I love Pakistan, Georgia, Oklahoma. I went to medical school in Oklahoma, so I'm particularly fond of Oklahoma. That's where I learned about tornado warnings. Being from California, I mean, I've been in a couple of earthquakes, but there's nothing quite like being near a tornado. Hello, in England and Houston, actually Thursday night, I'll be on the radio, LBC radio, like 2 o'clock in the morning or something. Every Thursday night I've been on the radio in London taking calls, LBC radio. All right, so multiple vitamin fish oil, optimize your vitamin D level. Then we make something I like a lot called Brain and Memory Power Boost. The brain doesn't get sick in one way, so it'll never get better in one way. So it actually has 6 nutrients I'm very fond of. Ginkgo, because Ginkgo boosts blood flow to the brain. Alpha lipoic acid, which is a super antioxidant and helps with blood sugar stabilization, which is very important for your thinking. Acetyl L-carnitine for mitochondrial energy, huperzine A, which increases the availability of acetylcholine, which is really important for learning and memory, and acetylcysteine, which is a super antioxidant, is just really important. And phosphatidylserine, which has been shown in multiple studies to enhance focus and memory. So those are some of the ones I like. To help with focus, we make something called Focus and Energy. It's got rhodiola, ashwagandha, ginseng, green tea. What is my stance on vaccines? My goodness. If you question them at all, people just hate you. I think vaccines have saved so much pain. You know, if you think of smallpox, which was just a disaster, it eradicated smallpox. But I also think you have to be careful. And the number of vaccines, we need to be thoughtful about it, because if you read all of the labels, there are potential side effects. Your best defense against COVID-19 is your immune system. Now, when they get a vaccine, and maybe by the fall, if the study from Oxford University pans out, I'm going to take that vaccine. I am negative for the antibody, and I see how devastating that it can be. So I'm not opposed to vaccines. I'm just opposed to giving small children a whole bunch of them. So we have to have a thoughtful stance. Laurel asks, how do I know if my partner's behavior is a personality trait or he had a traumatic brain injury? So you can have a bad personality or a difficult personality, but the question always I have is why? Is it because they were raised in an environment that created it? Or is there something going on in a person's brain that can be causing it? So if your frontal lobes work hard, you can have what we call obsessive compulsive personality disorder, worried, rigid, inflexible, things don't go your way. You get upset. That's no fun to live with. Or you can lack empathy and have antisocial traits. But unless you look at someone's brain, how would you know the cause? And I talk about this in my book, The End of Mental Illness. The cause is psychiatry basically has nothing to do with cause. It's like if you have 5 of these 8 symptoms, you're depressed, or you have ADD, or you have PTSD, or whatever. It's not talking at all about the underlying cause, which is why at Amen Clinics we do imaging. Because if you don't look, you don't know. And the imaging isn't everything, but it gives a layer of biological information that can help direct what we do next for someone. So the brain creates personality. Brain problems is going to lead to personality and relationship problems. Another question from a viewer is, Dr. Amen, is partial anosmia, which is trouble smelling, an indicator of Alzheimer's disease sometime in the future? Could be. Could also be an indicator of a traumatic brain injury. And traumatic brain injury, the damage tends to be stable, as opposed to Alzheimer's disease, the damage, is progressive. Can also be an indicator of COVID-19. Well, we learned very early on in this virus is you often lose your sense of smell and taste. I see Jeannie's question about husband recently diagnosed with dementia, started on medication. There's actually an article in JAMA that the medications help initially, like Aricept and Namenda, but long-term, not so much. You want to grab my book, Memory Rescue, and attack each of the 11 risk factors. We actually have a memory program at Amen Clinics specifically to identify and reverse each of those 11 risk factors. And people are very happy with that program. Next question. How do you deal with constant fatigue? Has it anything to do with your brain? Well, of course. If your brain has low blood flow, it has low energy. If you don't have enough ferritin, you can have low energy. If you have low thyroid, if you have low testosterone. In almost all of my books, and it's in the end of mental illness, you can't change what you do not measure. And so knowing your important health numbers that affect your brain are critically important to energy levels. Let's see. What do you recommend for post-concussion memory issues? In the end of mental illness, there's a whole chapter on concussions and head trauma. It's a major cause of mental health issues. And I recommend you start healing as soon as possible. I'm a big fan of hyperbaric oxygen. I'm a big fan of multiple vitamin fish oil. Optimize your vitamin D level. Also with concussions, there's a very high incidence of something called Irlen syndrome, where people become light sensitive. They have headaches, they have depth perception problems, they're just not as coordinated. And the treatment is actually wearing colored filtered lenses. It can just help so much. So you can go to Irlen, IRLEN.com, and learn more about it. Lots of sending abundant love and light. My mom always has feelings of guilt, which she has passed on to us. What could we do about it? Many of you know I talk about ants, automatic negative thoughts, the thoughts that come into your mind automatically and ruin your day. And there are 9 different types of ants, and one of them are guilt-beating ants. Guilt's just not a helpful emotion. Of course, there are things you should and you shouldn't do, like you should physically distance when you go out. I don't like the term social distancing, of course, but trying to motivate behavior with guilt, it's just not helpful. And so I replace I should do this with I want to do it, or it fits my goals to do it. And that really helps to know guilt is not a helpful emotion. And if you just replace it, so let me give you an example. Many people watching me know my mom and dad have COVID-19 or had. Then now they have the antibodies. They can do the grocery shopping. But if I got the thought I should go see my dad, well, that thought actually makes me feel bad because it's like I'm not doing something I should do. But if I just replace it with I want to see my dad, or it's my goal to see my dad, then I go see my dad. And I get the negative emotion out of it. And that just helps me so much. Another person writes, Dr. Amen, I have PTSD and have been on Prozac for a while now. What do you think? Well, the question is, what do you think? Is it helpful or is it hurtful? I'm a fan of medication if it makes your life better. I'm not a fan if you don't know if it works or if we could have done it in a simpler, non-toxic way. And the benefit of medications like Prozac is it can decrease negative feelings, but you have to be careful that they don't decrease all of your feelings. But if it really worked for you, I would just light candles at church and be grateful. How to manage obsessive negative thoughts. That's where you have to discipline your mind. Whenever you get a thought in your head more than 3 times, I want you to physically get up and go do something else. Physically get up and go do something else. Distraction can be really helpful. But if that doesn't work and they keep looping, I want you to write them down. And I don't want you to share everything you think. It's really important. All of us have weird, crazy, stupid, sexual, violent thoughts that nobody should ever hear. You don't have to share everything that goes on in your head. But write it down and then scrutinize the negative thoughts you have. And when you take it through an exercise, I call it, my ant killing exercise that I got from my friend Byron Katie. So an obsessive thought, I'm a bad person, or I don't know, I did something bad in the past and I can't get over it. Write it down. And then ask yourself, is it true? And I only want the truth in these questions. Is it true? I'm a bad person. Is it absolutely true? With 100% certainty, you are a bad person all the time. How does the thought make you feel? How would you feel if you didn't have the thought? But my favorite part is turn the thought to the opposite. I'm a good person. And ask yourself, you have any evidence that that's true? The disciplining your thoughts is just as important as disciplining children. Now, I don't want you beating children, and I don't want you beating yourself. It's not helpful. But we have to discipline children. That if I gave in every time Chloe, our 16-year-old, had a tantrum when she was 3, we'd have created a behavior disorder child. When you don't challenge and discipline your mind, you can create a mental illness, an anxiety disorder, depression. It's critical, and I've said this like a gazillion times since the pandemic started, mental hygiene is as important as washing your hands. We have to disinfect our thoughts. How to manage anxiety. I've posted a whole bunch of things over the last 6 weeks on managing anxiety. But basically, if I just think of the top 3 or 4 things, diaphragmatic breathing in a very specific way, 2, 3, 4 times a day, just do it for 10 minutes. 3 seconds in, hold it for a second. 6 seconds out, hold it for a second. So it's an 11-second breathing cycle. Do that 10 times. It's 110 seconds. It's a minute and 50 seconds. So for under 2 minutes, if you do that breathing pattern, in through your nose, out through your mouth, it triggers an automatic relaxation response in your body. Wow, that's sort of cool. Whenever you feel sad, mad, nervous, or out of control, write out your thoughts. Do those 5 questions. Soothing music can help. Hypnosis. I'm a huge fan of hypnosis and meditation on our website, BrainFit Life. If you go to mybrainfitlife.com, we actually have those exercises for you. How can I move on from the past? How can I move on from my mistakes? Well, one, realize everybody makes them, all of us. I mean, if I could go back, 65, and if I could go back and make some pivotal changes to some of the decisions I made, I absolutely would. But I can't. And I love this saying from my friend Byron Katie: argue with reality, welcome to hell. And so I don't spend a lot of time going, oh, I wish I did this, I wish I did that, because I can't change the past. The only thing I can change now is the present and what I do going forward. And so write down the mistake, write down the negative feelings, the negative cognitions, the negative ants, the automatic negative thoughts that go with the mistake, and challenge it. You are who you are today because of the decisions you make, but you're going to be who you are in the next hour because of the decisions you make right now. So some people see the past in front of them. I want you to learn to see the past behind you so that it's not, because when you see the past in front of you, you can get depressed. Because you look at the past with regret and it's in front of you, that's depression. Or anxiety is the future with fear is in front of you. So someone takes a daily dose of amitriptyline, and if it helps your headaches, I'm all for it. So I'm never opposed to medication if it works. If you have bipolar disorder and you're taking lithium, please don't stop. If you have schizophrenia and Abilify helps you, don't stop. But I want you also to get your brain healthy by doing the right things, and then maybe you need less lithium or maybe you need less Abilify. But if you have something that is stabilizing you, don't stop. My psychiatrist told me to stop taking Ginkgo Biloba because it causes heart problems. Seriously? No, it doesn't. That's ridiculous. I mean, if you're taking an ungodly amount that may be associated with some bruising, but I've prescribed 30 years. I've not once, not one time, seen it cause heart problems. You know, a lot of psychiatrists will tell you there's no science behind supplements. At the end of mental illness, there's a whole chapter called Mind Medicines versus Nutraceuticals. 286 scientific references on what has A-level scientific evidence. I'll just tell you some. A-level scientific evidence for anxiety: ashwagandha, theanine, omega-3 fatty acids. A-level scientific evidence for focus and energy: phosphatidylserine and omega-3 fatty acids, especially EPA. A-level scientific evidence for mood: EPA, omega-3s, saffron, SAMe, St. John's wort. A-level. And what that means is more than 2 randomized trials, either placebo-controlled or against a medication, with more than 2 placebo-controlled double-blind clinical trials. For memory, Ginkgo, phosphatidylserine, alpha-GPC, also called choline alphosphorate. for sleep, melatonin. So let us not say. But, to be fair, when I was in my psychiatric training, I got no lectures on using supplements to support the mind. It's just not part of our tradition. And also, to be fair, the pharmaceutical industry sponsored a lot of the American Psychiatric Association's publications, annual meetings. To say they're in bed with each other is just the truth. They're in bed with each other. It's not so true with supplement companies. I'm 42 years old and since the age of 10. Do you have any advice for me? Absolutely do. Bulimia, which is an eating disorder, and ingest large amount of calories and then you purge, either by making yourself throw up or you over-exercise or you take laxatives, is the most important thing is to really get a brain healthy diet, increase the nutrition to your brain, and then balance your blood sugar. Any sort of addictive behavior, people relapse when their blood sugar goes low. So eating healthy food consistently 3 to 5 times a day can really help you make much better decisions. And a lot of people with eating disorders have past emotional trauma. My wife, Tana, has a book coming out in January, and she's going to talk about the eating disorder she had when she was growing up and how a lot of it was based on just trying to control an out of control childhood and life when she was young. What is the best way to cope with forced paid time off during a pandemic? The best way to cope is to take this time and figure out what you really want in your life. And if you have paid time off, then there's less stress, but there's also less structure. But take time to figure out what you really want. Take this time to get physically and cognitively get your brain healthy. And then you can see going forward. And yes, we're, 16, 20, 25% unemployment. That means 80% of people are working. The economy is going to come back. And how do you want to be part of it? Were you in a job you absolutely loved, or do you have other goals for yourself? And that's what I really want you to fill out. I have an exercise called the one-page miracle. On one piece of paper, I want you to write what you want: relationships, work, money, physical, emotional, spiritual health. And then go, is my behavior going to get me what I want? And so if your job's not there, well, other jobs are going to be there. What do you want? And how can you get your brain and your body healthy so you can take advantage when the economy starts coming back, which it's going to start coming back. Another question on what's the best therapy for post-traumatic stress disorder. The best therapy, I love EMDR, eye movement desensitization and reprocessing. That's my favorite therapy. It's what I've seen really work well over time. There's another therapy I like called brain spotting, another one called havening. There are a number of psychological treatments that can really help. Someone's taking olanzapine and it's like, how did they lose weight? It's harder But if you're only on 5 milligrams, that's a low dose. I want you to start counting your calories. I'm like a huge fan. Whenever I gain 5 pounds and it makes me unhappy, I actually start writing down what I eat. That way you will not get calorie amnesia. And I think of calories like money, and I don't overspend. I have plenty of money, but I don't like wasting money. It bothers me. It irritates me. And I don't like wasting calories because I think of calories like money. So whatever analogy will really work for you, I think that's important. And then what's just as important as the calories is the quality of the calories. You could go on an 800 calorie a day Twinkie diet and end up inflamed and sick. So it's why I'm not a fan of Nutrisystem and other, they give you prepared food and they show the commercial where you can have cupcakes and donuts, and it's like, read the ingredients. And I'm not a fan of sugar and foods that turn to sugar. I'm not a fan of artificial dyes, sweeteners, preservatives. All of those things are bad for you. In the end of this, there's a chapter I like called Food, Made Insanely Simple. And it's like, eat this, don't eat that. So get control of your calories and eat brain smart foods, and add exercise to that, and make sure your vitamin D level is healthy. When my vitamin D level was low, I was hungry all the time. And when vitamin D levels are low, people become leptin resistant, which just means you're hungry all the time. You're not losing weight if you're hungry all the time. It's another reason I'm not a fan of marijuana, because marijuana makes people hungry all the time. Okay, I'm going on and on. I have a hard time sometimes with my memory. What can I do? So people who have memory issues, there's an 80% chance they're going to get worse over time unless you do something about it. And if you want to keep your brain healthy or rescue it if it's headed to the dark place, you have to prevent or treat the 11 major risk factors that steal your mind. And we know what they are. And SPECT, on our SPECT scans, we actually see if you're headed for Alzheimer's disease, up to 20 years before you have any symptoms. So if I see your brain is headed to the dark place, now's the time to intervene. And I get so frustrated. People go, well, my memory's no good, but I'm 40, that's normal. It's like, no, you have bad habits. Or I'm 50 and my memory's no good, that's normal. And I'm like, no, you have bad habits. Or there's a cause for that. Or I'm 65, and if I went, oh, well, my memory is no good, I'm 65. No, that's because something bad is happening in my brain. If your memory is not as good as it was 10 years ago, it's a sign you may want to look at your brain and get super serious about making it healthy. The red book behind me is my book, Memory Rescue, which I love. And it just step by step, how to have a better memory. And it's basically how to have a better brain. You have a better brain, you have a better memory. Somebody asked, when will Neurovite be back in stock? It is finally back in stock. I was so frustrated, but it is back in stock. I feel guilty for resting, napping, and I have a productivity obsession that makes me sad. Well, you want to, in a 24-hour period, get 7.5 to 9 hours of sleep. If napping helps you do that, be nice to yourself. I often ask people, would they ever treat their children like they treat themselves? And people go, no, Child Protective Services will have to come take me away. So are you treating yourself in a loving way, or are you being mean to yourself? That's not good. I work all the time on helping parents have a better relationship with their children. I want you to have a good relationship with your inner child and stop abusing that inner child by how you talk to that part of yourself. Could group therapy help people with depression? Or could it increase depression? I think it probably depends on the skill. I think it probably depends on the skill of the therapist. And too often people think, well, I went to therapy school, so I'm a good therapist. No, it doesn't work like that. A lot of therapists that are not great. Plus, they're trained on what I would consider outdated modes of therapy. That if you have Freudian psychoanalysis, I'm sorry, I'm just not a fan, because there's very little research showing that long-term it's effective. I want you to get your brain right, and then I want you to program it right, which is why I'm a fan of brain healthy strategies with cognitive behavior therapy, and then strategies they do in therapy like DBT, dialectic behavior therapy, which is really about how to manage your mind, how to manage your emotions. So I think of it like hardware, get your brain right, software, learn how to program your mind, network connections, how do you get along better with other people, and then underlying all of it is a spiritual connection, which is, why do you care? What is your deepest sense of meaning and purpose? So I'm always trying to help people in those big circles, the 4 circles: biology, physical functioning of your brain; psychology, your mind, learn how to manage your mind; the social connections, and meaning and purpose. That's how people get truly healthy. Okay. Last question. How do I deal with panic attacks? Panic disorder is very common, and the pandemic has not helped it. The pandemic has made panic attacks worse. So, 4 things. Number 1, when you're having a panic attack, don't leave. Stay where you are. Because if you leave, it's a store, it's a party. Well, nobody's going to parties, people are going to stores. If you leave, the panic will control you. So try not to leave. Breathe. Diaphragmatic breathing with your belly in that rhythm I just taught you. 3 seconds in, hold it for a second. 6 seconds out, hold it for a second. Do that 10 times. That all by itself is likely to break the panic attack. 3, write down your thoughts. And generally, they're fortune-telling ants where you're predicting the worst and then you're making it worse still. Write down your thoughts and correct them. And then 4, if those first 3 things didn't work, I'm not a fan of Xanax, and I'm not a fan of Klonopin. I'm just not, because once you start them, they're so hard to stop. I'm a fan of GABA. I'm a fan of theanine. I'm a fan of magnesium. I think simple supplements, theanine, magnesium, GABA. We make something called GABA calming that is just so helpful to take the edge off. But the first thing is managing your mind. Don't leave. Because if you leave, the anxiety will control you. Breathe in that rhythm. Write down what you're thinking. And then if you need a supplement to help with the anxiety, that's how I'd manage it. Every night, it's just so good to be with you. I hope this is helpful. I think about you. I pray for you. I know this is a hard time, and I look forward to seeing all of you. Have a great night.